CBT, DBT, EMDR, EFT, etc. Street drug names or types of psychological therapy.
Frankly, there are way too many types of therapy. How do you know what's right for you? How do you know what's right for obsessive compulsive disorder?
Believe me, there are times when I prefer the old-fashioned method of coping, bottling up my fears and compulsions until they erupt in a spewy, anxious volcano.
But apparently, that's not healthy.
As the world's leading experts in fear, we intend to get to the bottom of this phenomenon known as therapy. Welcome back to the OCDiaries. It's a big step to seek professional help, we know.
But it's not the 50s anymore when therapy wasn't hip.
Everyone's doing it these days.
All right, that sounds a little peer pressuring.
Whether you have a mental illness or not, having a therapist can rock your world.
Also, in case you forgot, we're going through a global trauma right now. You deserve a space to process.
With someone who's trained, not your partner, family member, friend who may not be equipped to take in your emotional baggage.
I started going to therapy when I was 10 years old because my parents were getting concerned by my constantly being haunted by thoughts of death.
I've been in therapy on and off since I was 6. I had to learn pretty quickly that it wasn't going to cure my OCD. It was going to help me find tools that lessened my anxiety. And it gave me a chance to try and explain what the heck was going on in my mind without being judged.
But what exactly does it take to be one of these mystical beings known as a therapist?
Yeah. Why are they so cool, calm, and collected? What are they hiding?
Here to talk about the educational process of becoming a therapist is a fellow OCD recipient, Ella Lynch.
Hi.
Thank you so much for coming on the show, Ella. Can you start just by telling us a little bit about what you're studying at BU?
Yes. So I'm in my first semester of my master's in clinical social work. That is a really versatile master's degree because you can use it to practice as a clinical social worker, which are considered therapists, but you can also use it to do elder protective services or child protective services or be a school social worker. I've always known that I wanted to be a therapist, and I picked the MSW program because it's a little more traditional. You don't have to go on to get a doctorate to be a psychologist or a psychiatrist. I live on the Cape, and part of the draw to BU was that they have a Cape Cod campus, which is actually based out of our Cape Cod Community College building. Mm-hmm. So I was kind of excited to be able to go to the community college twice a week, but now it's all online for the foreseeable future. But it's also cool because the people in my cohort, which is the Cape Cod campus cohort, are all sort of from the area. So they work at agencies that work with mine.
That 5 times fast, was it Cape Cod campus cohort?
Cape Cod campus cohort, yeah.
Cape Cod community college. So yeah, Ella, what drew you to this career choice?
Definitely my own experiences. I'm so sorry. There's a dog barking at a flock of turkeys outside my apartment.
A flock of turkeys.
That's
oh my gosh, that's worth barking at.
Having been in OCD treatment and anxiety treatment since a very young age. For a while, my family thought I was going to be a doctor, and I thought I wanted to be a doctor because I was always fascinated by weird body things and anatomy books and stuff like that. But I was more interested as I turned into a teenager, especially having shitty experiences in mental health too. I had a lot of providers, prescribers, psychologists, psychiatrists that were so incompetent, and I was I really want to do something like this but be better at it. I'm still kind of in the process of deciding if I want to be a therapist predominantly for anxiety disorders and OCD. I don't know if I'd be a good OCD therapist, but I know that I think I'm good at what I do now, which is a lot of case managing and coordinating for people who have severe trauma. I work at a homelessness prevention program in my area. And so we just do individualized case management for homeless and at-risk folks on the Cape. And they come in, well, not now, we're working from home, but normally they would come in the office, and I'm just doing compiling their paperwork or making sure that they are getting SNAP food stamps or WIC or things like that.
What is it like for your mental health to be someone who has what the kids would call a mental illness like OCD, to be working towards helping others, especially dealing with some of those heavier trauma aspects?
I definitely feel like I have to do more to work to not get burned out.
Yeah.
And it takes different forms for me. Like, so like, for example, a lot of my colleagues might want to go out for a drink or like a happy hour at the end of the week. And it's like, if I do that, I'll have fun in the moment, but then they might feel more rejuvenated on Saturday because they had a fun night out. But I would feel like so exhausted and drained from not only working all week, but then also having a social interaction. When we were in the office, it was pre-corona, but like coronavirus was about to get really bad. And so we were about to close. But I remember like really struggling with people who would come in and not sanitize their hands before they touched all my pens. Like, because my job is to like help people fill out paperwork. Right. And so I would be like, here's a pen. And then they'd be like, okay, here it is back. And I'd be like, no, you can keep it.
I don't want it. That also perfectly like leads into the next question, which is the whole reason we started this show, which is how has COVID impacted your OCD?
So the turkeys have migrated into my front lawn.
How many
turkeys are there?
They're like teenage turkeys, I guess. But I would say that I'm not typically the type of OCD person where I have to like, I'm not that neurotic about hand washing or cleanliness. It's more like the rituals and like general anxiety, intrusive thought part. And so in terms of like when it first started, I definitely was like giving myself dry skin from washing my hands so much. Mm-hmm. It sort of almost like veered into the health anxiety hypochondria area, which I've actually never really struggled with before. Knock on wood. So my diagnoses, I have OCD, and then I also have a generalized anxiety disorder. And so sometimes it's hard to, and then I also have depression. And then it's hard to know sometimes if it's just regular old anxiety or if it's like the OCD, like really popping up. I think OCD a lot of the time has a lot to do with my need to control things. Something that COVID has showed me is that you can't control other people's behavior. So like if I'm gonna always wear my mask, which I always do when I leave the house, even if I'm outside, even if I'm like alone, I'm gonna wear it. You know, if I go into CVS and I have my mask on and someone walks by me and they don't have theirs on, I can't control that, and I can't like ruminate on it for the rest of the day. I mean, I could choose to, but I'm sort of trying to mitigate that. To answer your question, less like the germaphobe aspect of it and more the like intrusive thoughts of like every little cough is, that's it, I have it, or I'm going to give it to a loved one. A lot of anxiety around giving it to someone, like a family member, more so even than having it myself. I feel like I'm going to have to keep this mask on my face forever now. Even though it's meant to protect those around you and not even necessarily to protect you that much, it still feels like this like barrier of like, if somebody spat in my face, I at least would have this.
What point would someone suffering from, a pattern of intrusive thoughts or a pattern of behaviors that seem irregular, would you suggest someone seek treatment?
A compulsion is a really unique feeling. And so I think if someone thinks to themselves in their head, for example, like I'll use one of my compulsions, like checking the locks on the doors. If you have to do it a certain amount of times, that's not something that you see other people doing. And so if someone's brand new to having symptoms and they are like, man, I feel like the physical drive to double check the lock on this door or triple check it or whatever, I think it's just a matter of tuning into changes in the behavior, but also it can crop up really early. And so I think for me, it was helpful because my mom noticed it. And then when I brought up like, Mom, sometimes it feels like I have to do that. I have to walk in and out of the door 5 times before I go into a room or whatever random thing. She'd be like, oh, well, that's something we can talk to your pediatrician about. But I think if you're brand new to symptoms, it would just be noticing that feeling of like, and a compulsion, I'm using the example of physical things, but also like those intrusive thoughts of like, this just doesn't seem right. Like it seems like it's out of my control in my head. As for actually reaching out and getting treatment, just finding a standard therapist, which is hard, especially like geographically. it can be really tricky. But a lot of places are doing telehealth, which I feel like is actually making it easier to get an appointment. And there's also those online counseling services, which I don't really know how I feel about them, like BetterHelp and stuff.
Mm-hmm. I use BetterHelp.
You use BetterHelp?
Yeah.
Yeah. Do you like it?
I started like maybe a month ago. I think it was a good decision for me. I hadn't been to a therapist in a few years, and I was just kind of avoiding it. But like, there's a pandemic, and I have a mental disorder, so
yeah,
like, clearly my anxiety's been worse.
A tip from me for online therapy would be to like go to a part of your house that you maybe don't go to that often, and like make it really nice for yourself, and like bring a glass of water. Like my therapist always offers me a bottle of water when I go into the office, and it like forces me to get hydrated. I think it's also really important to, interview your therapist just like you would kind of interview the employer of a job, just to see if it's a good fit. I have a friend who just tried to get set up with a new therapist, and she realized halfway into the first session that the therapist was an anti-masker. And my friend was like, oh no.
I'm honestly so glad you said that too, because I feel like people feel like once they, especially if first timers, as someone who has been a first timer and as someone who was in therapy as a child where my parents kind of picked out the therapist, you don't always realize that you have a choice in the matter.
It's hard. I feel like sometimes, like, especially in our specific geographical area, but I think this can happen in a lot of different places, especially rural and suburban places, it's harder to find providers. Like, there's just not a lot. And if there are some, then they don't take your insurance. Yeah. So if you find one, even if they kind of suck, or they're not a good fit, then you might not want to leave because you're like, well, it's going to take me forever. It took me 6 weeks to get this intake appointment. It's going to take me forever to get another one. I'm a huge fan of saying to your therapist, like, this way that we're having this conversation is not working for me, and it's making me uncomfortable, or like it's triggering me. And I think therapists like need that reminder too. So, but I think as anxious people, we're a lot less likely to do that.
As anxious people, and as like women too, I think there's a very, like, I don't want to tell someone they're doing something wrong.
Yeah, I know. It's like when you get a haircut and they're like, do you like it? And you're like, yeah, sure, I love it.
We've also been talking about therapy kind of generally, but there are different kinds too. What is out there in terms of like types of therapy that people can do their research into to see what might be a good fit for them?
There's one huge field of thought that OCD symptoms can be relieved if you treat the underlying trauma that caused it. And that's flawed because not everyone has underlying trauma that caused their OCD, but it's still worth a shot because sometimes you don't even know. Sometimes it might be repressed. So there's the general sort of psychoanalytic, like, let's talk about your early childhood memories and get to the root of the problem therapy, which is not the kind of therapy that I plan to practice just because I feel like there's such a place for it and it can be so helpful to so many people, but it seems like it can be really inaccessible. Mm-hmm. Having had a therapist who was like very Freudian and also a man, and he was very like, everything I said, he's like, let's bring this back to your relationship with your father. And I was like, it has nothing to do with that. There's definitely a place for it. But then my personal practices of choice for myself when I'm feeling symptomatic, but also like that I would recommend if I was practicing, would be like CBT exercises, cognitive behavioral therapy, and like mindfulness, which I originally, looking into mindfulness, I was like, this is a little woo-woo and doesn't even seem like clinical therapy to me. It seems more like yoga, which also has like huge benefits, but still I'm like, I don't know. But the more I do it, the more it helps me put things to scale, which is a big part of CBT too, of like, you know, how big is my anxiety? I work with a lot of kids. I'm like, how big are my feelings right now versus how big is the situation? How scary is the situation? There's a lot of OCD therapists who say like, don't give in to the compulsion. But I definitely take more of a gentle approach and like a sort of self-forgiving approach. So if it does happen, it happens, and then just recognize. The biggest thing that's been helpful with CBT for me is just stating the facts. So like, I just double check the locks on the doors. I now know that they're locked because I just locked them. And like, I'm feeling anxious tonight. Noted it. My therapist gave me a really good tip when I was convinced that my family and I were going to die of coronavirus. She was like, you should say, I'm having an intrusive thought right now. The thought is about this. Okay, stop, we're done. Like, no, and then just stop naming and just sort of sitting with it. And it's hard, but I think it takes the power away a little bit from the thought process in your brain being like, I am going to get sick and die, to I'm having an intrusive thought right now about getting sick. So that's my personal favorite, at least what's worked the best for me. Going into the field of social work, this is like a whole nother conversation, but social workers historically can be just as bad as police officers, and they can go in with this like savior complex, but then actually end up having this weird power thing, and going into lower income neighborhoods or neighborhoods of color, and like destroying families instead of rehabilitating them. Like, there's some serious long-term issues in the field. A lot of the people who come into my office are already mad at me because I'm not a licensed social worker yet, but they're like, oh, you're the 15th housing caseworker that I've worked with, and they've all been rude and like told me that I'm not gonna find a place to live, and I'm sure you're gonna do the same thing.
There's been so much of people saying, abolish the police and social workers can do these jobs. And like, social workers are better in that they don't have guns.
Right.
but many people have made good points that like that racism runs really deep in social work.
Yeah, no, absolutely. And I think it's a predominantly white, female, middle class dominated field.
Growing up in the early 2000s or whatever, social workers were kind of demonized, both in media and in my Sims game, every time they came to take my children away.
My area that I live in is very Blue Lives Matter-y, and a lot of the guys I went to high school with will post things like, well, can a social worker handle this? And then it's like a naked man with like a BB gun and like a bunch of...
saw that one.
And it's like, actually, that's our whole job, is to handle
and then the
things like
responses
that.
are like, actually, yeah. Social workers do that every day.
But at the same time, it's like the only real difference is that social workers, at least in Massachusetts, and it's so different state to state, but at least in Massachusetts, you can be a clinical social worker and make clinical choices and diagnoses. So a cop can go to a call about someone who might be experiencing suicidal thoughts and have no idea what to do other than like restrain the person and arrest them. At least the social worker would have some sort of education in mental health and crisis management, hopefully, because it's a clinical position. It's like a nurse almost, in that way of like, you sort of can do that mental health first aid piece. But other than that, I mean, I think for domestic violence calls, someone is maybe suicidal, drug overdoses. Sure, I think social workers would be happy to do that. But there's a lot of things that the police do that at least my peers in the social work field might not want to take that role on. And definitely going into the field in general, you just have to come at it with an anti-racist mindset, because otherwise there's just so many ways that you can re-traumatize people. When you're meeting a new therapist, you're completely allowed to say, hey, how do you feel about Black Lives Matter? And if the therapist says, I think all lives matter, you're allowed to leave. It's sort of like an interesting dynamic of like, do you announce that to a client, or do you wait for them to ask? Or do you put a sticker like on your file cabinet that says Black Lives Matter so that they just know going in?
I mean, obviously, if you're a teacher or a therapist, like, yes, you need to be very clear that you are open-minded and like you support, like if you're queer, you can come talk to me about it. There's that thing, if you have a kid or you have a client who's really conservative, you can't, there's going to be parents or whatever who are like, you're preaching your leftist ideologies at my child.
Like, being your authentic self is really important, and I think it is should be extremely important to anyone going into that field, if you expect people to be authentic with you. So it kind of goes back to what you were talking about earlier about curating both the space that you're in, even I think simple things like that, like having stickers that just sort of let people know where you're at, and then being open to those kinds of questions.
Our last question is, what bothers you about other people's assumptions of what OCD is?
I think it drives me crazy when people think that it's just hand washing, or just like, oh, I have to have everything be organized, or I love color coding things. In fact, like for me, it's the opposite, because I'm so anxious and so like all the time, like just my nerves are fried, that like my space is a mess. Nothing I own is organized. I had someone say to me once, and I told them I took an SSRI or something, and they were like, well, don't you like want to know what your real personality is like? Like, do you... And I was like, honey, like my real personality, I wouldn't be able to like be hanging out with you right now. Like my real personality is able to come out because I'm treating the symptoms of something that was inhibiting my actual personality. I don't know, I recently got into a little bit of like a Facebook fight with someone because they were like, well, it's okay to be on antidepressants or on anxiety medication, but not for the rest of your life. And I was like, no, it's okay if you're on meds your whole life. You wouldn't say that about like someone's lupus medication.
Ella, thank you so much for talking about your experience, for being so open with us. I learned so much just now.
Yay!
I'm ready to go back to school.
Ready to go back. Woo!
Both talking to someone who has OCD and is becoming a therapist, just
yay! And yes, thank you guys. I really appreciate that. Dancing my way out. I'm gonna wheel my chair out of the